So umbilical cord, a lot of people freak out about, you're going to use somebody else's cells on me, you know, and it's natural and it's, you know, it's scary. What, you know, it's the new frontier. So what rationale do you have why they would be safe? Well, you know, we do thousands of transplantations every year for bone marrow, the whole bone marrow thing when somebody has cancer and they do bone marrow transplants to restore, and that's a different subject, okay? But thousands of those are done every year safely, and of course they have to be matched and they have to be immunosuppressed, and there's a whole lot that goes with that, but those are done. As far back in the 1930s, when we ran out of blood, they started using cord blood, and they gave tens of thousands of units of cord blood as a replacement for blood transfusion, right? If somebody lost, you know, too much blood, then they used the cord blood instead of, you know, donated blood. So there's a long history of that. In the Lancet, there's a study they showed 128 patients were given cord blood. So this it's not even, the stem cells haven't even been isolated, but the stem cells are in there and all the other cells are there, and 128 cases, no adverse effects. Journal, the American College of Surgeons, 413 units of cord blood was given. In another study, absolutely no side effects. We've given more than 1,000 injections, and we've had 2 cases of rash reported with no other side effects. So I always look at it, you know, maybe from a 30,000-foot view, but is this a natural process to take cells from one person and put them into another, right? Well, in 2004 in the Lancet, and since then many papers have been published, but every mother who's carried a child has the stem cells of that child in her bone marrow. Every mother, right? So, and we know that they're genetically distinct. They're at least 50% genetically distinct, and they may or may not be HLA matching, but it doesn't matter. They persist up to 30 years later. So every mom who's carried a baby has stem cells from their baby. And it once was thought that mothers, because of this microchimerism, they call it, where a small amount of stem cells set up shop in mom, that there were increased levels of autoimmune diseases because somehow those cells were creating immune clones that were attacking. And they actually did a prospective trial of sclerosis, and they found that the inverse was true. The stress and the physical and sometimes emotional stress of bearing and raising a child would actually decrease your lifespan. But the inverse is true. This is a study where they followed a bunch of families, and they found that actually you got about 1/3 of a year per kid. Your longevity increased 1/3 of a year per child carried up to 14. And then I think the suicide rate went way up. But anyway, I find that fascinating.